How are you doing today?
I'm doing well, but yourself?
I'm doing great. My name's Brittany. I'm going to be your nurse for today. Can you tell me your name and your date of birth?
Rodolfo Lopez, 10/20/96.
Okay, and then I would verify that with his wristband as well. So what I'm going to be doing today is inserting a nasogastric tube into your nose, down your throat, and into your stomach, okay? Did you have any questions about it?
Does it hurt?
It shouldn't hurt. There might be a little bit of discomfort just because it's might be an uneasy feeling of it going down your throat, but it shouldn't hurt. If it does, if you don't feel any pain or anything like that, you can let me know by like tapping on my arm, okay? Okay. So do you have any allergies to latex?
No.
Okay. So I'm gonna perform hand hygiene, and I would raise his bed to working position and make sure to put him into high Fowler's position, and I would provide privacy for him. So first, I am going to assess his nasal passages. And then, can you open your mouth for me, please? Say ah. Okay. And then I would also assess for his gag reflex as well. So, first I'm gonna measure it, and I would also have tape as well. So I'm gonna measure it by tip of his nose to his earlobe, and then down to his sternum. And then I would mark it off right there with a piece of tape. So when I put it in, if you're just gonna swallow for me, so I would either give him like water or like ice chips to suck on so he can swallow. So what I'm gonna have you do is just tilt your head back. So I would start by advancing it into his nose, then down his throat, into his stomach until the piece of tape reached the end of his nose, and then I would secure it on his nose. After that, I would check the placement and make sure it's correct. So I could either do that with a pH test or preferably an X-ray. So after that is done, I would make sure he is okay and he doesn't need anything. I would wash my hands and document everything on how it went. And then once it came time to remove it, I would follow the same procedure. I would verify his identity, check it with his wristband, assess for allergies, wash my hands, provide privacy, and I would explain to him, so what we're gonna do. So what I'm gonna do is I'm gonna take the tube out of your nose. It's gonna be quick, not gonna prolong it, so you just hold your breath when I take it out.
Okay.
So that's what I would explain to him. I would let him know if he needs me to stop for any reason, just to tap on me again. I would take it out, put a like a gauze or something over it, so when I take it out I can just wrap it in that, dispose of it. I would ask him if he needs anything, if he's okay, and then I would wash my hands, make sure he's comfortable, put the side rails up, and put his call light in reach. And that's it.
Thank you.